Good afternoon, everyone. Thank you for joining us. If you're joining us online, we do have a hybrid lecture today. If you have any questions or if you have any audio issues, please just put those in the comment box at the bottom, and we will get those addressed with Emily. If you guys have any other audio issues, just put those in the comments. Otherwise, today's lecture is on dysautonomias and chronic fatigue after COVID-19. And otherwise, Emily, thank you.
Thank you. So my name is Emily Rich. I'm an occupational therapist at Tucson Medical Center. Let's go ahead and move forward. So as I mentioned, I'm in the clinic at TMC, and then I'm also a PhD student at Texas Women's University studying occupational therapy. All right, so this is an overview of what we're going to be talking about today. We'll start with just some brief definitions. What is dysautonomia? What is long COVID? And what's chronic fatigue? And then we'll move into very briefly what the challenges are. But the bulk of what we're going to talk about today is treatment, because I think that's what most people care the most about. And then at the end, we will wrap up with a summary, and I'm happy to answer questions. All right, so let's start with a definition of post-COVID conditions. So the CDC identifies them as a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after first being infected with the virus that causes COVID-19. Even people who did not have COVID-19 symptoms in the days or weeks they were infected can have post-COVID conditions. And these conditions can present as different types and combinations of health problems for different lengths of time. All right, so we're going to use the term long COVID throughout this presentation. I might switch in and out of using a couple different phrases. They're all synonymous with post-COVID conditions, long haul COVID, post-acute sequela of COVID-19 or PASC, and also PACS. So we have lots of nomenclature as of now. But we do know that long COVID does not discriminate between different ages. There are children that are getting COVID as well as long COVID as well as adults. And we do see it more commonly in people who are born female. It is not rare. It likely impacts between 20 to 30% of those infected with COVID, and potentially 10% of those who have been vaccinated against COVID-19. Separately, we'll go ahead to the next slide. We need to begin with a definition of dysautonomia. And you can see there's lots of different types of dysautonomia under here. And about 60% of long haulers are meeting criteria for some form of dysautonomia. It's dysfunction of the autonomic nervous system and includes a variety of different symptoms, presentations. There's different mechanisms that cause each type, and so we're not going to go in depth in these, but what we will talk about is your autonomic nervous system. So what is your autonomic nervous system? It's the system that regulates your automatic body functions, such as breathing, digestion, heart rate, temperature regulation, salivation, circulation, bowel and bladder control. So we don't really think about it, it just should naturally happen. And then you might have heard of orthostatic hypotension, which is the most common form of dysautonomia, common in older adults and affects the blood pressure with positional changes. You may have also heard of a condition called POTS, or postural orthostatic tachycardia syndrome, which is characterized by a substantial increase in heart rate at rest with a positional change. So from moving from laying down or seated to standing position, there's a 30 or 40 or more beat per minute increase in heart rate at rest. So it's worth developing an understanding of what the autonomic nervous system is. We're not going to go in crazy depth today, but I think it's really empowering to understand what is happening, especially because we know this is often impacted in long haulers. So broadly, you can see there's a division of 2 primary branches. which at some point you might have heard of as the fight or flight response and a rest and digest response. Know that I'm making this grossly oversimplified for the purposes of this presentation, but briefly, when you're in that state of fight or flight on the left side here, or sympathetic activation, our pupils are larger, we have drier eyes, we're focusing on distance vision as we scan for any possible threats. We don't produce as much saliva, our heart rate and breathing increase, and digestion slows or even halts, and we do not release urine or feces, and our blood vessels actually tighten up to send blood to our core and to fuel our organs. On the opposite side, on the right there, you'll see the parasympathetic system, which is basically the opposite response. And so functionally, what we might see if we're spending more time in that sympathetic state or that fight or flight state, we might see light sensitivity, dry eyes, dry mouth, some anxiousness, shallow breathing, gastrointestinal upset, color and temperature changes in the hands and the feet. Cold hands and feet are common, or clammy hands and feet, amongst lots of other symptoms. The other important condition for us to define is chronic fatigue and the actual medical diagnosis of chronic fatigue syndrome. So in itself, fatigue is this persisting sensation of full body exhaustion, which is different from feeling sleepy. It might feel like your arms or legs are like lifting heavy bricks, and it might be similar to the sense when you have the flu. It doesn't get better no matter how much you sleep. On the bottom here, you'll see the condition myalgic encephalomyelitis, or chronic fatigue syndrome. So we used to call it just chronic fatigue syndrome, but as time goes on, we've developed our understanding of the brain and that what is actually happening with chronic fatigue syndrome. So there's some of the characteristics of it are post-exertional malaise, or PEM, unrefreshing sleep, cognitive impairment, orthostatic intolerance, or difficulty with upright and positional changes. It's traditionally been associated with an infection at the onset of the symptoms, such as parvo or Epstein-Barr virus, which is commonly known as mono. So you can imagine why we're talking about it today, because now we're seeing a huge uptick in people with ME/CFS. Just to get a sense for what fatigue actually feels like, I like this quote. It says, "Fatigue robs us of our ability to think clearly and our motivation. Your body feels like it's powering off like a dying battery." And fatigue is a perception of how much energy we have. So people with rheumatoid arthritis will often describe their fatigue as feeling completely wiped out or utterly exhausted, or how I feel when I'm coming down with the flu. I mentioned post-exertional malaise. That's a common characteristic of ME/CFS, and we're also seeing it in some people with long COVID. Now, PEM, post-exertional malaise, it's not simply fatigue, and there is sort of a difference between regular fatigue and PEM. And this does not apply to everyone with long COVID. So it's an important distinction to learn about yourself and determine whether or not this is actually a factor for you, because it significantly changes the way we approach treatment. Some key elements of post-exertional malaise are that it follows minimal physical, cognitive, or emotional exertion, or very little activity in relation to the amount of fatigue that you have. It's characterized by a delayed onset, so not right after the activity or during the activity, but you might go a whole day or two and feel fine, and then all of a sudden it hits. It's also characterized by a prolonged symptoms. So this isn't just you feel sick the rest of the day. This is typically days or even weeks, and potentially even a month or more. And then the symptoms are unique and appear much more like the flu. They might include a fever, swollen lymph nodes. These are people who actually probably would not be here in person today, if I'm honest, because it's really hard for them to get out of the house. And then examples of PEM given by the CDC are attending a child's school event may leave a patient housebound for a couple of days, unable to do needed tasks like laundry, grocery shopping. That might cause a crash, require a nap in the car before they can even drive home after grocery shopping, and they're unable to do anything for days after. A shower might leave a patient bedbound and unable to do anything for days. So that gives you a sense of what PEM looks like. If that sounds like your type of fatigue, then it means we're going to approach return to exercise and just your whole course really very differently in a much more cautionary and slow way. Nearly everyone with long COVID experiences fatigue, but based on the research, that's what we see. But I don't imagine that all of these folks are experiencing post-exertional malaise. All right, so briefly, we will go into some of the challenges. Symptoms, I could have made multiple slides. The symptoms go on and on and on, really affecting all body systems. But what I really want to focus on here is that what I'm concerned about as an occupational therapist is that these cause impairment in daily life function. And so we know that a lot of long haulers are not able to return to work, not able to go back in the same capacity, and even their day-to-day life is very, very different. So I want to spend the bulk of our time on what do we actually do about this. The biggest message that I want you to take away from this lecture today is that adaptation is key. So try as best you can to have an open mind, and adaptation is not always easy. All right, so in managing fatigue, we're going to look at, there's two different types of fatigue. There's primary fatigue, which is really due to the condition itself. And then there's secondary fatigue, which is indirectly might be due to poor sleep, poor nutrition, your changes in your routine or exercise activity levels, and then additional stressors like all these medical appointments and the fact that your health isn't very good at this time. That's going to affect your mood, understandably. We also know that there are 3 different categories, at least, impacting our overall energy levels. And so those include physical energy, what we traditionally think of as energy, but we also are affected by cognitive or our thinking demands. So if I have to work really hard to complete a task, maybe there's bright lights, there's lots of sounds in the background, someone is speaking, it's harder for me to understand them. I have to work really hard to keep up. It might be for some of you how quickly I'm speaking because I have a lot of material to get through. But the point is that that also contributes to our energy levels. And then finally, emotional shifts, highs and lows, really exciting, really positive emotional things, and also really upsetting. Both ends of the spectrum can be really depleting, or it can also be restoring if you can find that middle balance of emotional demands. So the ultimate goal is preventing fatigue in the first place, rather than trying to claw our way out of this hole that, getting further and further into more and more fatigue. So learning what your triggers are for fatigue can be huge. The first and maybe the biggest that comes to mind right now is the heat. We live in the desert and it is so hot, and people often underestimate the impact of the weather. But it could be other things like sensory overstimulation, lights, sounds. It could be too much movement happening around you. Stress. For women, menstruation often causes flares. Environmental pollutants, maybe days when the environmental conditions are worse. And then also health changes. So if you have a cold or the flu, I would expect your fatigue to be worse, and I wouldn't be concerned about it because it's probably going to go away and get better. But just when your body is going through something that's harder on it, tends to be more of a trigger. So we want to use concepts of pacing all day, which I'm going to talk more about. And we want to do that every day, which I recognize takes energy to be able to pace. So the goal, though, is trying to be efficient with your energy. So working smarter, not harder. All right, so if you are having consistent fatigue, how can we make changes? Well, one is considering ways to actually restore your energy. How can you actually get energy? What fills you up? It's different for every person, but it might be, having a really wonderful conversation with someone that you love or spending time with somebody. It might be movement, gentle, graded movement, getting restful sleep and balancing that with our time awake, not spending all time sleeping, but trying to find that balance, regulating stress, getting natural sunlight, having proper ideal nutrition and hydration for your body, and breathing practices and self-compassion strategies are a couple that I'm a big fan of. And so ultimately, this idea of plan, prioritize, and pace, those are three helpful P's to kind of keep in mind. Over time, pacing does actually expand the amount of energy that you have at the start of each day. And so I keep using this word pacing. What does that really look like? So that might be breaking tasks up into smaller chunks, not pushing through and doing the whole entire task. As soon as you get the sense, I just need to do one more, like it's only going to take me 5 more minutes, you've probably already gone too far at that point. So we never want to push if we're feeling like I just need to push through, but we actually probably want to err on the side of stopping even before we're feeling that way. So if we stop before we get to that point, we'll probably have more energy to use throughout the day or the rest of that week. Another example might be, don't go grocery shopping. I'm an occupational therapist and I want you to be able to do whatever you want to do. But if you can order your groceries online, most places there's a $30 minimum and it's free after $30 to get your groceries picked up. If you think about all the aspects that you're going to avoid, you're not going to have to walk through the grocery store, walk through the parking lot, get out of your car, and then it's really hot when you get back in. The cognitive demands of having to follow a list and then go find all the items in the store. The visual demands of looking down at your list, looking for things, scanning. There's so much that's involved in just going to the grocery store. Plus the physical piece of walking and lifting. And I always use this example because we lift so many times grocery shopping. It just seems like the most inefficient thing to me. You grab something off the shelf and put it in your cart. You take it out of your cart and put it on the conveyor belt. You take it off of the conveyor belt or the bag and put it into your car. And then when you get home, you take it out of your car and bring it into your kitchen. And so let's skip all of those steps before you take it out of your car and you put it into your kitchen, right? It's like amazing how much energy you can save that way. It's not lazy. It's actually just really smart, because what happens is then you'll have more energy to do other things. Another idea is, can you bring a cooler bag to the grocery store? And so then you might put, items that could melt or your refrigerated items, and only take a couple bags out of the car and then rest. But you'll know those items are safe, and at least in the summer. In the winter, it's much easier. Alternatively, trying not to stay seated or to stay still in the same position all day long either. Laying down, especially in bed, and staying in the same room and environment is actually often really draining of our energy. And so trying to find that balance, you're going to hear that's a key today. Where is the in-between? Not one extreme or the other, but really finding that in-between. Here are a few more concrete examples of ways to pace, so you can get the most bang for your buck when it comes to your energy. So if you've ever heard of spoon theory, the idea is that you have a certain number of spoons every day, no more, no less. You're given the number you're given, and every activity throughout the day takes a different number of spoons. And once you're out of spoons, you're out. So if it's 5 o'clock and you are out of spoons and you still have to shower and cook your dinner and eat and, get yourself to your bed, you're actually going into negative energy levels. And so the next day, you're going to wake up feeling a lot worse. So really trying to find that way to even it out. And so sitting down to do tasks, it actually saves you 25% of the amount of energy that you would use standing up to do a task. So if you think all throughout the day, what are activities that I could do sitting down? That can be helpful. Trying to avoid scheduling all your appointments on the same day. We want to avoid what we call boom and bust cycles. So rather than, I feel pretty good, I'm going to do everything today because I don't know how I'm going to feel tomorrow. And so I go out and I do all the things. What happens is then you'll usually crash. And not only just crash for the next day, but a lot of times people will crash for several days. Sometimes people say, but I did it and I got all the things done. But what we see is over time, you actually end up doing less and you actually have less energy. So how can we even out those boom and bust cycles so that you only have one appointment per day in the week, and then you let yourself rest before you get to that extreme? Other ideas are using adaptive equipment and modifications to do things. Again, it's not lazy. It's actually the way that you'll be able to do more. So trying to keep that kind of optimism in mind, rather than feeling like I feel weak that I have to use this device. It's the idea that I'm storing this energy so that I can go do something that I otherwise wouldn't be able to do. And then tapping into your support systems and delegate. Most likely people want to know how they can help. And sometimes it's really hard to ask for help, but you will be able to give more if you do less. And that's something that we have to come to on our own, but just something to consider. I'm not going to go into this slide, just wanted you to have it. So if you go back on the recording, you can see it and pause it here. This really applies to people who have post-exertional malaise, and it's about the idea of monitoring your heart rate so that you don't exceed a certain amount. And it can be a helpful way to learn, what are things that really, really exhaust me. Some people can become obsessed with monitoring their heart rate, and so I think it's really helpful to do it with a therapist or a clinician, but it should be used strategically and can be helpful. Okay, movement, maybe the most controversial thing with long COVID. But I want you to remember that movement does not have to mean exercise in the traditional way. Our activities that we do all day long might be considered movement or exercise for you right now. So a lot of folks are experiencing exercise intolerance, which is something very common to people with POTS, a form of dysautonomia, or ME/CFS. And so we do know some strategies that can be really helpful for getting people back to some degree, what they could do before, whatever that looks like in terms of endurance and exercise. So it doesn't mean that activity is bad for you. And it also doesn't mean that you should go to the extreme and you should just push yourself. It's definitely finding that middle balance. Movement boosts our red blood cell volume, which is a really good thing that a lot of other things can't do for us. So there's something very positive happening in our bodies. Even though we usually feel worse when we're doing it. If we have a condition like long COVID, exercise probably does not make you feel good, but the goal is long term, it's going to make your body feel better. When in doubt, err on the side of caution. Do not push yourself. If you have a personality that is very, go, 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 or you're an athlete, it can be really hard on your body after all that it's gone through to then push into really intense exercise. I would really recommend you work with a therapist, but I know that not everybody has access to therapists, and so here are some ideas. Starting seated or laying down or in a reclined position are easier on body. So here's some ideas of activities that you might be able to do that are in those positions. But the best thing you can do is the thing that you'll stick with. So finding what you actually enjoy. You might not be motivated to do it every day. You might have to push yourself, but trying to find something that you actually enjoy. And balancing cardiovascular and strengthening. Deconditioning does not cause long COVID, which we now know because there are athletes and all kinds of really fit people developing long COVID. But deconditioning can lead to worsening of your symptoms. So we just want to try and stay as fit as we can. Be this little desert tortoise here in the middle, right? Slow and steady really, really is the key. When exerting, I prefer using the modified Borg of perceived exertion scale rather than heart rate measuring. This scale measures your breathlessness, and I think it helps you to tune into your body better than looking at a device. It doesn't mean that watches and activity trackers are bad, but I really want people to pay attention to what's happening in their body. So you can see here that in the middle, that 4 to 6, you can hold a short conversation versus being at a 7 or an 8 when you can only speak a sentence. You're doing exercise, movement, your daily activities. Ask, if you're cleaning your house, try, can I speak a sentence right now? And if that's laborious, if that's hard for you, you need to take a break. You're pushing your body probably too hard, depending on where you're at in your recovery. And you can find this just by Googling it online. It's just this 1 to 10 scale. Symptom logs can be very helpful for you and your healthcare providers. Whether you log in a journal or you use the notes in your app, your phone, the notes app, or some other app. There's lots out there. But just consider a few variables. Like I mentioned, those triggers that I mentioned before would be really good ones to pay attention to. Did I spend more time in the heat? Was it a hotter day? A lot of people that are feeling worse the last month, the heat has gotten a lot worse, so it's pretty understandable. Also consider sleep and nutrition, lots of different factors. Trying not to get obsessive over it, which can be hard, but again, trying to find that balance, and it can be really empowering if you notice trends with your body. This slide is especially important for the people with dysautonomias because hydration is really important for anybody that's here today, whether you have long COVID or not. The trick is finding the balance between sodium and fluid. So I usually recommend just increasing your fluid by a glass of water every day. And just stick with that for a couple of weeks and see how you feel. There are lots of water bottles that can help to make this a little bit more successful. I have a picture here of what we call time-marked bottles you can find on Amazon that encourage you throughout the day. At 8 a.m., you should be at this line. And the trick, though, is it's really easy for some people to just go crazy with drinking a lot of water. The issue is that then you're now depleting the amount of sodium that's in your body. I know this is strange, but for POTS specifically, it's actually recommended that you increase your salt or your sodium levels. And so there's an example on the right here of an electrolyte or a salt supplement that are little capsules you can take as pills. But then there's other types, electrolyte powders that you can add to water bottles, and they're not all made the same. So drinking a Gatorade, that only has about 150 milligrams of sodium. It's basically nothing in the POTS world. Drinking something like a liquid IV, there's a supplement called LMNT or Element. There's one called Scratch. There are a lot. But you want to look and see if you can find one that's about 500 milligrams or more per serving. Estimates range in terms of how much sodium you should add if you do have a form of dysautonomia, between 4 to 10 grams a day. And the typical American diet, we get about 3 to 5. So you want to add some level. Huge caveat here. If you have high blood pressure, if you have myocarditis or pericarditis, or if your physician does not recommend you increase your sodium, ignore all that I just said. This is only for people who've been told by their medical providers to increase sodium. There's also things like Gatorlyte and Pedialyte, which are Pedialyte Sport or something like that, which have more than the traditional Gatorade or Pedialyte. Compression. So in POTS, what we are seeing is blood pooling in the legs and in the lower body in the trunk. And so we often recommend wearing compression, especially on the lower body. So you can see an example of compression leggings here. And I recognize it's hot, as I've said 100 times already. So layering is probably not ideal for most people. It is nice, especially for women. There are these leggings that just look like normal athletic leggings, so you can wear those by themselves. But then there's also socks. Compression socks are not going to do quite as much. They still are helpful for some people, but the ideal situation is wearing leggings that go from your ankle to your waist, plus that other picture there with the abdominal binder or abdominal compression. So what's happening is we're basically helping to passively push the blood that might otherwise be pooling back up into the upper body. And the heart doesn't have to work quite so hard to pump that blood back up. Try to find 20 to 30 milligrams of mercury in terms of compression tightness. 30 to 40 is really hard to put on, especially if you have any amount of fatigue. And any less than 20 to 30 doesn't really do enough. It's more for athletes that are just trying to get a little boost. And like I mentioned, when you have fatigue, it can be really hard to get these things on and off. And so there's devices like that picture on the bottom, also wearing rubber kitchen gloves. There's a way you can do it with a plastic bag, that anything you can do to help. There's a lot of options, and so just don't give up at just trying it on by yourself, because there's a lot of things that we can do. Also, the second best option than the leggings plus the abdominal binder is actually just the abdominal binder. So even if you're a person who cannot get the leggings or the socks on, but you want some support, trying an abdominal binder, that one I put there is $20 or $30. They're relatively inexpensive and can be easier to get on and off. Sleep. So even in the non-COVID population, we saw a steep decrease in quality of sleep during the pandemic, with less than half of people, not just people who infected with COVID, but just people, less than half had refreshing sleep. And then sleep issues are known to be a challenge already in people who have dysautonomias and often with people with fatigue. And so this is just the tip of the iceberg. I could talk forever about sleep, but really considering those circadian rhythms, that's our biological drive for sleep. And so whatever you can do to help your brain and your body to know, this is when I go to bed and this is when I'm awake. So that might be first thing in the morning, get sunlight, an hour of sunlight, whether you're outside or you're inside, with a window with direct sunlight on you. Some people also use light boxes, but really trying to tell your brain this is the morning. And then I love to recommend, going for a walk or watching the sunset around nighttime, because what happens is as that sun sets, our brain is saying, okay, I'm going to produce melatonin now, which is a natural chemical in our body, which tells me that it's time to go to sleep. Anything else you can do like that? Food actually also is a part of our circadian rhythm, so keeping consistent meal times, those kinds of things. And then fatigue and sleep have a strong relationship both ways. So fatigue makes your sleep worse a lot of times, and sleep can definitely make the fatigue worse. So there's this thing called sleep hygiene, part of what I just was mentioning, but other things like keeping a consistent sleep routine, even on the weekends, going to bed around the same time every night. And if you're not tired, don't go to bed. We used to tell people, go to sleep at 9 o'clock, even if you're not tired. We don't say that anymore. If you're not tired, it's not usually productive for you to go into your bed. And so it's better to wait it out, even if that's like 1 in the morning, but be consistent with that for a while. And then what we do is slowly back it up by 30 minutes or more week by week. And it's a pretty slow process. No lights on when you're sleeping. Even the littlest bit of light can really disrupt sleep. And same with sounds. Some people don't realize that they're having like micro arousals or these little blips in their sleeping pattern, even when they stay asleep. And so if you're rising to that surface level of sleep and you're not getting that deep sleep, that really affects your overall quality when you wake up. So using white noise or brown noise is often better tolerated. It's a little lower pitch. Or headphones, if you have a snorer in your bed, like there's these Bluetooth headphones that can be for sleep. So trying to find any way to decrease those disruptions. We fall asleep better if the environment is cool. So if you have a swamp cooler in Tucson in the summer, that's going to be a little bit rough. But maybe using some cooling devices. And then keeping your bedroom reserved for sleep and any sexual activities. So really avoiding spending time in bed during the day. It's really hard for a lot of people, but I would much rather you rest in a lazy boy, on the couch, even on the floor, outside of your bedroom. It's going to make a big difference for your sleep. And then there's a strong association between sleep and your mood and any mental health changes. So that's something to really keep in mind. One quick app that I wanted to list here that I really like is called CBTI Coach. It's a free one. I forget who it's funded by, but it's a really great app. It doesn't have all kinds of ads or anything. It's paid for by an organization. All right, I'm going to pause here because I recognize that if you have long COVID, you likely have some kind of cognitive impairment or effect to your cognition. And so as a therapist, I would be remiss not to say that this would be a great time for you to pause if you are pacing. If you're watching online, I'm fine if you drop off and leave. Like, I would much rather you do that than to push yourself past that. And if you're here in person, if you need to take off, you will not insult me in the least bit. I know this is a lot of content, but I really want to make sure that you have access to it, even if you go back to it later. So I'm going to keep going for just a few more slides. I promise I'm almost done. But newer research has come out really in the last few weeks showing that the cognitive changes that we're seeing in long COVID are the equivalent to a drop in 10 points of your IQ. We don't know that that is permanent. It's probably not permanent, especially to that degree. But what I want you to hear is that it's valid. If you are feeling like, I'm not tracking the same way that I was before, I'm just not as with it, it makes sense, and it's probably very real. From other conditions, we know that cognition and the cognitive effects often get worse with other symptoms getting worse. So on a day when you're really fatigued, I would not expect you to be on it with your cognitive skills because all that energy is funneled into the same bucket. And so again, going back to those triggers and really trying to find a way to balance your overall health. So if I'm really dizzy, if I'm in pain, all those things are going to affect my cognitive or thinking skills. And then from an autonomic perspective, I often describe this to my patients with dysautonomia as a focus on your basic biological functions. If your autonomic nervous system is off, those basic things have to come first. Your brain is not worried about problem solving, about remembering somebody's name. That all goes out the window. So I sort of if you've heard of Maslow's hierarchy of needs, sort of recreated a simplified version to say those physiologic needs are the foundation of everything else. And the next piece is safety, and our body has to know that we're safe. And so if we've had an experience with trauma, if for whatever reason we are not feeling safe, forget the ability to go into our heads. Eventually, there's more boxes that I would put, but up the chain would be those higher level cognitive skills. That's at the top pretty much. So we need to be able to pump blood through our body, breathe, regulate our temperature, do all of those basic things. And so using the other strategies often help to result in improvements in cognition. There's new information every day, as you know, if you're following any of the long COVID research. Literally every day there's new information. But at this point, it does not look like the infection is actually in the brain. It's yet to be determined, and in 3 weeks I could tell you something else, but the latest research is showing that. We do believe that the immune system is overactive, and it's a bit of a chicken or the egg situation at this point, whether the brain is causing the immune system issues or the immune system is causing the cognitive issues. A study this year showed that there was not a significant difference in the cognitive impairment post-COVID in those hospitalized versus those hospitalized. Again, pointing to the fact that the severity of your COVID initially does not correlate well with how you're doing functionally with long COVID. All right, so we know that this cognitive impairment exists and it's real. What do we do about it? At this time, lots of compensatory strategies. Remember when I said adaptation would be key. It doesn't mean it's not going to get better, but similarly, what triggers it, what makes your brain less efficient, and also what makes your brain more efficient? Those are questions to be asking yourself. Some things to consider: focusing on one thing at a time and eliminating distractions, background noise, lights, movement, that all counts as multiple things at once, especially when your nervous system is hypersensitive or hyperreactive. There's no such thing as multitasking, despite what lots of people will tell you. What we're actually doing when we multitask is we're switching really quickly between two or more things. And so when you've had some kind of insult to your brain or to your nervous system, the ability to do that really fast is not going to happen as well. And so it's going to be exhausting. So instead of switching back and forth between your phone and the TV or whatever other device you have in front of you, or trying to listen to someone talk while you're doing something else, that's exhausting for the brain. So really honing in on one thing at a time. And on that note, let the brain rest. Don't jump into one thing after the other. Let the body process whatever has happened. Compensate. Don't waste precious brain capacity on things that you don't need to use it for. So I'm so glad we have the paper here today. You can write down questions if there's something burning in your mind, rather than rehearsing it over and over in your mind to try and remember. It's just a waste of your energy. So instead, write things down, use calendar reminders, alarms, sticky notes, ask somebody else to help you. Cognitive rehabilitation is not just overwhelming the brain all the time. It's not just constantly doing another puzzle and constantly challenging yourself. You really have to be able to let it rest as well. And then consider how anxiety or depression might also factor into the cognitive function. And please do not be afraid to ask for help. There are resources, and we are here, and do not suffer alone. If you need any mental health support, I would be happy to help you. I know that anyone at TMC would be happy to put you in touch. And the Pima County Health Department just got a grant recently to be able to help children and adolescents with free counseling supports. There are also resources for adults, but I just wanted to let you all know about that one. And then sensory regulation can be really impactful. I brought it up a few times because I think it's under-recognized. For example, the use of weighted items similar to a weighted blanket, you can see in the bottom right corner, that's called a weighted lap pad. Anything that can help the nervous system to calm. So avoiding sensory stimulation, not all the time, but trying to minimize the amount. And then also giving your body some of that feedback. The word proprioception is a really helpful word in this context, that if you want to look up some more on getting feedback for your body to help it to feel grounded, that can help with some of the cognitive pieces. Quickly, a tool that I like to use with patients is the Healthy Mind Platter. I'm not going to go into it in depth here, but something that's worth looking up as a resource. It's free online. Basically, it's all the ingredients for a good day. Not that you have to do everything every day, but cognitively and psychologically, these are really good elements to have. And I like to highlight time in, which is spending time inside, reflecting internally. Downtime, which is not just I'm not doing as much or I have the TV on, but it's actually letting your mind wander, dozing off, like daydreaming, just giving that space in your calendar. And then also play. doing something creative, doing something novel, and something you enjoy. Those are all really good for the brain. The brain is what we call neuroplastic. It's constantly remodeling, rewiring. There's so much flexibility in there. And so we want to fire the areas that need to come back online that maybe aren't activating as well right now. And rest is also an essential piece of this. This is just a menu of ideas that you might include in a week that are pieces of the Healthy Mind Platter. So we're nearly at the end. I just want to briefly touch on ideas for those who've lost their sense of smell or taste and have not yet regained it. It's about 12% of people with long COVID. And some studies suggest that improvement will occur within a year in 60 to 80% of people. So a year is a long time, but that's still something that is possible. And we should not be dismissing the loss of taste or smell as if it's any less important. If you think about safety concerns, there was a 2-year-old boy in Texas who woke his parents up. Neither of them had their sense of smell, and there was smoke. And he woke his parents up saying, "Fire, fire." On top of that, food, whether or not food is expired. We have these things for a reason. And so I think it's an easy one to dismiss as not being important. But it can also affect our nutrition. People might stop eating as much, not have food be palatable. So adding things, if food feels bland, adding onions or lemon, strong sensations can sometimes help. But smell training could potentially also help. I'm not going to go into this in detail, but you're welcome to reference it if it's helpful for you. I would recommend that you work with somebody. There's not a lot of people who know really precisely how to do this, but I've included some of the most important details on here, being like you just do small bunny sniffs versus this long, deep inhale, because that's going to go into your throat. We're not worried about it going into your throat. We want it to stay in your sinuses. And you're just trying to use scents that you have strong memories with, strong associations, and then you're thinking about those memories and those experiences with that smell. Always good to check with your medical provider before beginning smell training. And last but certainly not least, as it's probably my favorite topic of them all, is the idea of autonomic training. So I've used the word autonomic nervous system a lot throughout this lecture, but there's something called heart rate variability, or HRV, which we know from the research that it's actually often lower in COVID long haulers. Basically, it's a measure of well-being and resilience of your body. And so it's a calculation of the variation in time between heartbeats. So when we're nervous or when we're in a situation where, let's say there is a fire, we want our body to go into that fight or flight state. That is really important and necessary. But when that's not happening, we want our bodies to be able to rest. And so that ability for your heart rate to fluctuate is a positive and is a good thing. So fortunately now, and I think the pandemic expedited, there are lots of things you can do at home. There's just a few products I listed here. Leaf is that bottom picture. It's just a little thing that you stick on. It has electrodes and it connects to your phone, and it is biofeedback, feedback about your body all day long. It cues you when you should take a deeper breath. HRV is heart rate variability. And then there's something called the Well-Tori app, which is on the right. And basically what we can do now is we can use the phones, your camera on your phone to check your heart rate variability. It's not 100, it's not as accurate as if you were to go into a doctor's office, but it's pretty good considering you can do it at home. And so Juva Health, that bottom one, is a free app traditionally used for migraines, but you can do heart rate variability with that one. Stasis breathing is a program that's been used with long haulers around breath work, and biofeedback in general. So for example, in the clinic, I use heart rate variability biofeedback, meaning that we're helping you to learn how to change your breathing patterns and to recognize what's happening in your body. And then also thermoregulatory, that just means temperature regulation. So if your hands and feet are cold, you're more in that state of fight or flight. What can we do about it? And same with muscle tension. We are not going to try practice because we don't have time. I kind of figured we would, but abdominal breathing is often really helpful. Can be triggering for people who had any trauma if you were hospitalized and on a respirator, anything like that. So slow and steady is important. Just a few resources that I really appreciate. Kristen Neff is the guru of self-compassion, and I just love her work. The Royal College of Occupational Therapists has a really great resource online that's free called How to Conserve Your Energy, Practical Advice for People During and After COVID-19. So that's a word that's worth looking up. And then Johns Hopkins came out with this resource very early on. So a lot of people have seen there's one called Bouncing Back, and then there's a resource called Breathing Exercises in their COVID-19 rehab resources. Based on the World Health Organization estimate of 237 million worldwide COVID infections, this globally pooled estimate indicates that 100 million people currently or have previously experienced long-term health consequences of COVID-19. So the burden on our healthcare system is astronomical. And so whatever we can do to help you here, that's why we did this series. There's also a panel that we did with the Pima County Health Department that you can find online that was recorded. And then Dr. Mo, who's he's a sports medicine specialist at a concussion center in town, seeing a lot of COVID patients, did a cognitive lecture here. I'm really active on Instagram and post lots of free resources because I know there's so much need. So if you want to follow me there. And I just want all of you to know that we believe you. If you've ever been doubted, I'm really sorry. And that's not okay. But going forward, there's going to be more research and there's more and more that we're going to be able to do. All right, that's it. So we can take questions now.
Do you recommend weighted blankets?
Yes, so the question is, do I recommend weighted blankets? Yes. And one of the keys is how long you're wearing it for and how much weighted there is. So, you know, now you can buy them just like even at Target and you know, places like that. I don't necessarily recommend them all night long, which is how most people use them. But basically the most benefit you'll get out of it is in the first 20 minutes. And so if you wear one on your body, even if you're sitting up and you just kind of drape it for 20 minutes and then check in, right? Do I feel any different? Did I feel like it was helpful? Yeah. Sorry, yeah, go ahead.
I have to relate to the symptoms of dealing with fatigue just because of my age. It's very similar, although we did take care of a daughter who had this condition for 9 months in California. But I find that a lot of these suggestions work for somebody who doesn't have those symptoms, who's in their 80s.
Absolutely, yeah. The point of just that fatigue is also experienced often by older adults, and a lot of these can be helpful for those people too. Yeah, go ahead.
I actually use a weighted blanket
Okay.
because I have sleep problems.
Okay.
And it's got all these little glass particles inside it. And so I wear it all night at the advice of my sleep specialist.
Oh, good.
If you take it off your bed, it's just plain too heavy.
Absolutely, they are heavy. Yeah.
Our daughter used
Yeah, weighted blankets for sleeping all night long, that can be helpful. And weighted lap pads are a good alternative because they're so heavy, the blankets. Yeah, go ahead.
What are the dangers regarding reinfection and COVID-induced POTS? Is there anything known about that right now? Because I'm very concerned about my son. He had apparent COVID was early on. He wasn't able to be tested.
Okay.
And now he's been diagnosed after about a year, 15 months. He was diagnosed by Dr. Brian Blair.
Good. Yeah.
With POTS.
So what is the potential dangers with POTS post-COVID?
Yeah, in terms of reinfection.
I don't have an answer in terms of infection specific. What I do know is that I want to say 30% of cases of POTS were triggered by an infection, a viral onset of an illness. So in that way, I don't think that it's a lot different than the existing cases of POTS that we had pre-COVID, especially if he's been formally diagnosed with POTS.
Is it dangerous to be reinfected?
Oh, I see what you're saying. Yeah, okay, so that's a great question that a lot of long haulers have, and I think that, so the question is if it can make you worse, basically, if you were to be reinfected with COVID, and what are the potential dangers with that? So the biggest thing that I often see is that people might have a regression in terms of their progress with symptoms. Just like I mentioned, having the cold or the flu, any other thing with a person that has POTS, traditionally, if you get sick and you spend more time in bed, laying down, your symptoms probably are going to get worse. But it doesn't necessarily mean that you're not going to get back to the same place that you were at. And the biggest thing I tell people is just try not to stay laying down in bed the whole time. Really try and get up, change positions, and move around. I can't answer it though specific in terms of COVID because we just don't know enough about reinfection with POTS, but just in general with an illness, that's what I would say.
Yeah, we've experienced that with my daughter who's recently diagnosed with POTS, that she was making great progress and then she was down with an illness, and it was very frustrating because she felt like she was back at square one.
Yeah.
But her progress back to where she was faster.
The whole POTS thing with tachycardia and lack of sleep was a disaster. Because,
Your daughter, yeah.
You know, one is bad enough, but the two together with POTS is
No fun. Yeah, absolutely.
it's a challenge.
Is there any incidence of these symptoms of people who just had all the shots and the boosters?
It's a really hard question to answer.
Nobody wants to answer that question.
Nobody wants to answer it. And so I'm not going to shy away from saying that I have seen people who have experienced adverse symptoms after vaccination. Whether they had COVID at the same time that they got the vaccine, like I can't, we don't have research on it. And I'm really sad for those people that they just don't really understand what's gone on. But they present very much like others. So we're treating them, basically like long haulers. So, and what we do know is important to say is that a lot of long haulers who've had a vaccination after getting long haul COVID have felt better because I can't explain the physiology, but basically the virus, the vaccination is helping to minimize the amount of the side effects or the symptoms. Yeah, potentially. Yeah, not in everybody, but yeah. Yes.
So, question about compression. So my son is using compression socks.
Yes.
It helps him when they go to the knee.
Mhm.
So I assume it's because the veins aren't working properly to push the blood up. So since that's the case, I mean, how would it work having just the waist thing or just ankles up to the waist? I don't understand how that works.
Yeah, I can't exactly just, because you're absolutely right. So what's happening is, so when you're wearing compression socks, they're helping to push the blood back up. Most likely what's happening is the blood vessels are what we call like distending, or they're opening up. They're not contracting and helping to push the blood back up in the same way that they would in a typical person. We also know, though, that there's some blood pooling in the abdomen a lot of times. And so I think the abdominal binder is mostly helping with that abdominal pooling. But all that I know is that they did a study 2 years ago now, and that was what they found, was that, the waist high plus the abdominal was the best, but the abdominal was very comparable. Yeah.
And is
So
that in all age groups?
I'm not positive if they tested it in any adolescents,
Yeah,
but
specific body
yeah.
types or age groups or anything?
not positive. Yeah.
Yeah, our daughter is still wearing the waist high
Yeah.
compression after it's been 2 years since she got it early on before anybody really knew what it was.
Yeah. Go ahead. I saw your hand up.
Is the brain fog the same as the cognitive impairment, or it is a different thing?
It's a good question. So brain fog is sort of a colloquial term that shows how they feel, right? Like I feel foggy. I feel like I'm my brain's going through cotton or something. We sort of use that term because we don't really quite understand brain fog. It's just a description of what patients are experiencing. So in a sense, yes, we're using them interchangeably, cognitive impairment and brain fog, just because it sort of encompasses how patients feel. But typically what we're seeing is memory issues, attention and concentration issues, and then some language word finding issues. Yeah. Yeah, is there a question online?
He has me online that asked if you were finding patients that experience fatigue more than a year after having COVID.
Yes. Yeah, there are definitely people now who are even 2 years out, obviously, and are still experiencing symptoms.
I'm already more than 2 years up to now.
Everybody's very individual, but unfortunately there are several people who have experienced that. Yeah.
I would think that if you're going to wear the waist compression, that you should discuss it with your doctor first, because if you have lung issues, it might affect your breathing. I'm an RN, so I'm just saying it's,
I would put the caveat of anything that I said, you should ask your doctor first before, and then if you get the go ahead, then I can help guide. Yeah. Any other questions online or anything?
He doesn't even ask if it's a repeated question. There's a question about the brain fog.
Oh, yeah, the question was what was the difference between brain fog and cognitive impairment, whether or not they're one and the same, basically. Is that okay? Yeah, and I would say they pretty much are for the purposes of this. Yeah.
One person just commented and said, be careful about weighted blankets if you have back problems, because I guess her weighted blanket causes a lot more back pain.
Yeah, so caution with weighted blankets with back problems. Whenever you introduce something new, take an inventory of your symptoms, like really pay attention to before and after, because those subtle things can make a big change that we kind of minimize what they could be doing. And so I think that's important. Yeah.
Is brain fog related to dizziness? Are they associated?
Brain fog and dizziness. So I sort of commented that any of the other symptoms can make the brain fog worse. So if you're having dizziness, I would imagine that your brain fog would be worse. Similarly to, we talk about like pain brain, like people who have chronic pain often have cognitive issues as well. And I go back to that idea that like if your body is not, if there's something going on that's interrupting your basic level of function, it's really hard to tap into those higher level skills. So dizziness, absolutely, yeah.
Do you treat teens with POTS?
I do.
You do.
Yes, the question is, do I treat teens with POTS? Yes.
And you're a TNC.
And I'm a TNC, yeah.
It's been life-changing for my daughter.
All right. I think that's it.
Any questions?